Hello, this is Dr. Carol Motley, Associate Professor in Family Medicine here in Mobile at the University of South Alabama College of Medicine. The following webcast focuses on the theme of enhancing patient education. Why spend the time it takes to educate patients? There are several very good reasons. If you look at the causes of premature death in our country, the largest reason is unhealthy behaviors. 40% of premature death could be prevented by developing healthy lifestyles. Behavior can be modified, however. It takes the patient to be engaged and motivated to make change. Patient education about consequences of their behavior is the first critical step towards making change. This requires appropriate and targeted medical education. Sure, the patient knows they need to quit smoking, but what are the risks to continuing smoking? And how does one begin to stop smoking? The obese patient knows they need to lose weight, but most are unaware of the composition of a healthy diet or what a healthy portion is. The following projects that will be presented have focused on the most significant behavioral health problems in our country. Patient education projects such as these are critical to improving the health of our nation. These are projects that I believe should be continued and developed further. Seeing the hard work and dedication of these medical scholars leaves me with gratitude and hope for the leadership of the future. Please listen as they share their passion and commitment to making a difference for patients through their projects.
Good afternoon. My name is Chantelle Albert. I am a second-year medical student at Morehouse School of Medicine in Atlanta, Georgia. This summer, I have the distinct pleasure of being assigned to Central Mississippi Health Services Incorporated in Jackson, Mississippi. The title of my project is Healthy Foods, Healthy Moves. Healthy Foods, Healthy Moves is an interactive workshop designed to encourage children, the pediatric population, to improve overall wellness by adopting healthy and sustainable habits. Healthy Foods, Healthy Moves also served as a pilot investigation of the effectiveness of interactive workshop as a means of patient education. The basis of my project was found in evidence produced by the American Academy of Family Physicians. They supported the fact that small lifestyle changes can have great beneficial effects in the long run by those who are willing to adopt changes in their lifestyle on a daily basis. So, the objective of Healthy Foods, Healthy Moves was to counsel at least 12 individuals regarding lifestyle changes and help them improve their overall understanding on wellness topics such as body mass index and reading and comprehending nutrition labels. Healthy Foods, Healthy Moves also served as a pilot to investigate interactive workshop as a means of effective patient education. The methodology used was pre-test, post-test design. The pre-tests were administered to participants prior to the workshop, and the post-tests following the workshop to gauge the effectiveness of the workshop itself in providing education to the participants. The key findings. Overall, the post-test did indeed reflect an increase in the number of correct responses following participation in the workshop. So it can be said that interactive workshops indeed are and can be used as an effective means to increase patient knowledge on certain topics. Based on these findings, several recommendations can be made. For one, it is very important that providers and doctors continue to provide patient education on the one-to-one basis at each encounter, but also patient education opportunities in group settings can be very effective. Participant engagement is very important, so tools such as tracking logs and additional literature can be provided to patients who are willing to use them and to those who are seeking more information. Other methods of getting patient and participant involvement should be investigated and included in overall wellness plans. Thank you.
Hi, my name is Lauren Auer, and I'm a second-year medical student at William Carey College of Osteopathic Medicine in Hattiesburg, Mississippi. My PCLP placement site was at Bayou Clinic in Bayou La Batre, Alabama. My independent research project targeted smoking cessation and patient education. Individuals that came to the Bayou Clinic that indicated on their health history that they were smokers were asked if they would like to take a survey on their smoking habits. On the survey, I asked if patients would be interested in smoking education and participating in a pilot program to help them quit. Those patients that indicated yes were educated on the health and financial benefits of quitting smoking. Additionally, they were educated on the social benefits of quitting, as I found many patients were not fully aware of the dangers of secondhand smoke. Patients that indicated they were ready to begin a smoking cessation program were enrolled in a 5-week pilot program. This pilot program targeted reducing a patient's daily nicotine consumption over time to help them reduce the body's dependence. The patients identified their starting nicotine value and then for the next 7 days switched to a cigarette brand that was 0.1 milligrams of nicotine per cigarette lower than their previous brand. The patients were provided a guide that categorized different brands of cigarettes by nicotine levels so that they knew what level to switch to next. After 7 days, the patients moved down another level on the pacing guide. When beginning the program, the patients were offered the option of reporting their progress to the clinic or having follow-up calls with them via phone. The ultimate goal of the program is to have patients reduce their daily nicotine intake to a low enough level that it's a patient up to be more successful in quitting. By making small changes over time, the patients will be motivated by their success to continue in a smoking cessation program. The results of my pilot program were very encouraging. Of the 41 individuals I was able to provide smoking education to, 20 decided to enroll in the pilot program, and 10 fully participated. The remaining 10 withdrew either for personal or health reasons. Of the 10 individuals, all 10 were successful and able to reduce their nicotine level from their original starting value. Some key findings were that patients that opted to call in their progress to the clinic failed to do so in 100% of the cases. However, patients that opted to receive follow-up calls indicated in a post-survey that the calls were influential in helping them stay on track. The most common of the pilot program by patients was the increased desire to smoke more cigarettes per day, as well as the cost of switching between certain brands of cigarettes. In my recommendations to the Bayou Clinic, I strongly encourage providers to consider this as an option, a smoking strategy to help patients quit. Additionally, I recommended that providers that had patients on a smoking cessation plan follow up with their patients to encourage them to remain on the plan. Also, I encourage providers to strive for a 75% education rate of smoking patients that come through the door on an annual basis.
Hello, my name is Neha Brown, and I am a rising second-year medical student at Morehouse School of Medicine. This summer, I was assigned to work with the AwesomeMed Health Services Corporation in Los Angeles, California, to complete my independent service learning project. My project was focused on establishing a sustainable evaluation plan for AwesomeMed's Raising Emotionally Healthy Children parenting program. This program was initiated by a former AwesomeMed pediatrician, Dr. Perry, when she noticed parents having trouble controlling and correcting the behavior of their children while in the waiting room and exam rooms at her clinic. This intervention provides parents with children aged 6 months to 6 years a solid foundation to guide their parenting practices and ensure success in their child's future. While many parents have verbally expressed their satisfaction with the program, the current evaluation plan has failed to yield the desired results. To address issues with the evaluation plan, my project involved evaluating surveys from 6 previous Raising Emotionally Healthy Children parenting classes, analyzing the surveys to understand reasons for an overall low response rate, and suggesting and implementing changes to the evaluation plan to ensure its effectiveness and sustainability in the future. It is imperative that a reliable evaluation plan is established to ensure the further development and larger-scale implementation of the Raising Emotionally Healthy Children parenting program to the other communities that AwesomeMed serves.
Obesity is one of the leading health problems facing the United States today. According to the CDC, more than 33% of children and adolescents are considered overweight or obese. The focus of this project was to counsel children about nutrition and weight management in hopes that they would carry these tools with them into adulthood. This was accomplished using the REACH method, which stands for Record, Exchange, Adjust Portion Sizes, Commit to a Goal, and Hustle Up. Each pediatric patient and their parents were first given a pre-assessment to assess their knowledge regarding nutrition and their current exercise habits. The patients were then counseled on nutrition and exercise using the REACH method. We began by recording what a typical day of eating was like for the patient. We then went over some healthy meal alternatives that they could exchange for some unhealthier options already in their diet. We discussed how to adjust their portion sizes, and then each patient was asked to commit to a goal of adding some type of healthy option into their diet. We then went over how they could engage in some form of physical activity. After this was completed, the pediatric patients and their parents were given a post-assessment to assess whether or not they found the REACH method to be helpful, if they thought that it would improve their overall health, and whether or not they would recommend the method to someone else. Some of the key findings from the research was that majority of patients believed that they already had a healthy diet. Patients seemed to be aware of accurate portion sizes, but needed counseling on applying this knowledge to their personal diets. Also, patients found the REACH method of nutrition and exercise counseling useful and applicable to their daily lives. And the majority of patients reported that they were likely to follow through with the REACH commitment. As far as recommendations, I would recommend that Matthew Walker continue to put the REACH method into practice with their pediatric patients. I also recommend that the nutritional counseling have a focus on educating the patients about how an unhealthy diet can affect them right now. My final recommendation is that the REACH method should be expanded to cater to different types of specific health conditions, such as high triglyceride levels, high blood pressure, and diabetes.
Hello, I'm Emmanuel Johnson. I attend Meharry Medical College. This summer I did my project at the Matthew Walker Comprehensive Healthcare Center in Nashville, Tennessee. The name of my project was Developing Pediatric Nutrition, Intuition, and Many Exercise Programs. As healthcare in America costs more and more, we as healthcare providers must switch from disease treatment to disease prevention. And in that, exercise and nutrition is the foundation to any healthcare plan. My objective for my project was to increase patient knowledge on diet and exercise, and to furthermore increase compliance to healthier eating habits and increase physical activity. To enact this, I used pre and post assessments that were given before and after the actual provider's encounter with the patient in order to evaluate the patient's knowledge. Afterwards, I would read the pre-assessment, and before I would go in and consult the patient, I would look over what they said, what they may or may not have gotten right, and I would use that to guide my education session. Then I would always follow up the education session with questions and any other just miscellaneous things the patient may have had questions on. Then I would hand out a food label handout that would pretty much just dissect how to navigate reading a food label, and I would make sure before I left that I would answer any questions. At the end of my education sessions and handing out pre and post assessments, I analyzed my data, and I came to find that in regards to diet and exercise, it's really not that the patients don't know, because they do, so their intuition is not the problem, but rather implementation. Patients know what to do, they know how to eat, they know how to exercise, they just need to know how to put that into action. Also included in my findings, I also noted that most patients said that they wanted more education on sex-related topics from their provider. So that was just very interesting as to, what was going unanswered in the clinics. My recommendations from my project was, since Matthew Walker already has a nutritionist on staff, I would, advise them to actually use that nutritionist to actually help patients in implementing diet and exercise into their daily lifestyle. Also, it'd be very easy to add a quick sex, nutrition, exercise screening to the MA or RN's triaging of the income patients. Thank you.
Hello, my name is Courtney Lee, and I am a rising second year at Ohio University Heritage College of Osteopathic Medicine in Athens, Ohio. I was placed at the Bayou Clinic in Bayou La Batre, Alabama, and I did my service learning project on patient education obesity project. The objective was to educate patients on obesity, equip them with ways to reverse obesity, and to empower them to live healthy lives. Specifically, I focused on the harmful effects of obesity, body mass index, and portion control. Patients with a BMI of 30 and above were given an obesity survey. They were educated on obesity and also given the opportunity to join a weight loss program. Patients who were enrolled in the weight loss program were given a pre- and post-obesity survey. A weight loss plan was developed in shared decision with the patient. 1 week after the educational sessions, follow-up calls were done for the patients, and also weight checks were done after 2 weeks of being in a weight loss program. My key findings were 100%, which is 31 out of 31 of the patients were receptive to obesity education. 71%, which is 22 out of 31, consider themselves overweight. Patients want to learn more about how to lose weight, cook healthy meals, and exercises to help lose weight. Most patients buy food from places that don't have affordable healthy choices. Within the 2-week weight loss program, 33%, or 2 out of 6 patients lost weight. Motivation for weight loss program, 50%, 3 out of 6 stayed the same. They were ready to lose weight. 33%, 2 out of 6 increased from being unsure about losing weight to ready to lose weight. And 17%, which is 1 out of 6, decreased in their motivation for weight loss from being ready to be unsure about losing weight. Moving forward in the future, my recommendations are to continue obesity education with emphasis on what normal body weight looks like, BMI, portion control, and understanding calories and weight loss. Patients who are ready to take action should leave the clinic with a weight loss plan, a small change that can help them live healthier lives. They should have multiple avenues to reach weight loss just in case one doesn't work for them. This concludes my project summary. It was a privilege to be a part of this GE Primary Care Leadership Program, and I definitely enjoyed my time at the Bayou Clinic in Bayou La Batre, Alabama. Thank you so much.